Low back disc rehabilitation is performed first by polishing or hydrolyzing the low back disc area, removing scar tissue and help preventing future arthritis. Exercises for the low back disc would be to grab a knee with a single leg pump. This exercise, however, is performed by bringing the knee up until the patient feels the affected portion of the back and then polishing that portion or that level. The higher up the knee comes, the more up the back you're going to feel the pump. After the patient pumps one leg, it is advisable that the patient pumps the other one, starting with the non-affected leg first, bringing the knee up until the patient feels the effect, definitely not going into pain, but a comfortable position, comfortable short range of motion, comfortable tension. Do it until it feels better on this particular exercise. It could be 5 seconds, it could be 15, 20 minutes. Next exercise is to use both knees. The patient will get a hold of both knees, and again, if I want to hydrolyze or pump the L5S1, then it is right there. I can feel the tension in the L5S1. If I want to feel the tension in the L45, it's right there is the tension in the L45. If I want to come up to the L2, then I have to bring right there. The higher the knees, the higher you're going to be pumping the disc at that particular level. And again, the patient will do a double leg pump. The most important muscle that a patient can develop for a low back disc condition is the stomach. The stomach is made up of rectus abdominal, transverse, serratus or obliques, serratus anterior. Lying position is a good place to work the stomach muscles. The patient will contract the stomach muscles but not lift the chest. Primarily, it will be a pelvic tilt where the patient just lightly tightens the stomach, smashing the spine into the table under my fingers. I tell a patient to smash a bug. So contract it, you got to hit it harder. Tighten, 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 crunch, smash, 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 smash. Very good. The next exercise is called the bridge. Patient will open their feet, grab their buttock with both hands, lift. If at any point this is uncomfortable, the patient has to stop this procedure and only do it standing. The patient will bridge, and again, flexing the quad or the hamstring, the glutes, the low back muscles, bringing it up to a level of tension and flexing. Comfortable positions, comfortable short squeezing range of motion, comfortable tension, doing it till it feels good, and then the patient will come down. The next procedure is called a morning star. The patient drops a leg. The patient rolls onto their side, facing here, grabbing the upper knee or upper thigh with the lower arm. Taking the elbow, stretching, dropping the elbow back, tightening the stomach, bringing the knee over, distracting the disc. Again, if there's any discomfort, the patient has to stop immediately and go into the comfortable position. The next exercise is called the McKenzie. The patient rolls over, lying on their abdomen. Gets their arms underneath them and gets right flat and gets comfortable, rotating, gets comfortable. As soon as the patient is relaxed and comfortable, are you comfortable?
Yeah.
Then you work up to your elbows, lightly lifting the arms. And if that's too high, put your elbows out wider so it's not so high. I'm sure we all remember Larry Bird lying on the sidelines of the Boston Celtics bench, where he's lying on the side on a towel doing the McKenzie exercises because he has a herniated low back disc that was relieved by the McKenzie exercises. Once the patient is in this position, if they can get comfortable, they then can put their arms even out wider into a push-up position and push even up more into the McKenzie position. Then the patient comes down, turns on their side, and sits up. When the patient sits up, the sumo squat is crucial to align the disc into its pure juxtaposition. So the patient sits up, puts feet apart, pushes in knee, lift chest to neutral, push in knee, out hands, lift chest, squeeze the buttock, and then stands in the perfect straight up position. The most important exercise that a patient can perform for stabilization and relief of disc is again the stomach. The patient can do exercises of the rectus abdominal, the oblique, and the serratus anterior, best performed standing by taking a piece of tubing, doubling it, putting the hand in like this, 2 fingers out, the other one is just hanging on to the knots, placing the tube over the top of a door, bringing the elbows down into into this position and lightly flexing the abdomen. You can then work the oblique by working the left side, and you can work the obliques of the right by flexing the right side. I call these exercises the show exercises because primarily these exercises are for show. The most important abdominal exercise you can perform for a herniated disc is called the transversarii, the muscle that attaches from the backbone and the spine itself to the linea alba, the stomach, runs transversely along the inside of the stomach. Every single morning, a patient needs to be performing, before they even get into the shower or anywhere else, 100 belly button tucks. This is performed by taking the belly button and pulling it back towards the spine and then lifting slightly, using all the muscles. So back and up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The belly button tucks has many, many benefits. One, it has a hydraulic effect. For every pound that you pull in with the belly button here, you get 1.5 pounds of lift on the spine or the disc. Number 2, the transversarii muscle is a white twitch muscle, meaning it has its capability of holding its contraction all day long. Number 3, when my belly is out, my chest drops, my SI separates, my vertebral body's disc go into a shear force on the disc. When the belly button is tucked, the chest comes up, the SI is locked, the vertebral bodies and discs line up, and even a herniated disc, if it is in pure compression, can withstand thousands of pounds of pressure.